All right, the last thing we need to do in this unit is take a look at the endocrine system and homeostasis on your homeostasis chart. So again, you're going to be on the side with your name, and the top square should involve the integumentary system. Now, the integumentary system interacts with the endocrine system because the endocrine system stimulates our sebaceous glands as well as hair growth, fat distribution, as well as stimulating our sweat glands. In addition, some of our hormones actually alter our blood flow to the dermis. And finally, certain hormones will stimulate our melanocytes. With the nervous system, the endocrine system is going to alter our neural metabolism. It's also going to influence the development and behavior of the central nervous system. With the skeletal system, the endocrine system is going to regulate our skeletal growth and our maintenance. It's also going to adjust our blood calcium levels by using the bone tissue. So if blood calcium levels are too low, we will actually use hormones that will tell the osteoclasts to actually break down some of that bony matrix to mobilize some of the stored calcium into the bloodstream. On the other hand, if the level of blood calcium is too high, a different hormone will actually tell the osteoblast to take some calcium out of the bloodstream and add to the bony matrix of the bone. With the muscular system, hormones are used to adjust our metabolism, also the growth, the calcium, and the phosphate levels that are necessary for the muscular system. In the cardiovascular system, the endocrine system is going to regulate red blood cell production. Okay, we talked about that EPO last at the cardiovascular unit with the blood, so that is under hormonal control. Blood pressure is also under hormonal control. Heart rate and the contraction force are also influenced by certain hormones. With the lymphatic system, certain hormones have anti-inflammatory effects, and they also stimulate the development of lymphocytes, which are critical in the production of antibodies. Within the respiratory system, hormones actually stimulate respiration because they can monitor the oxygen levels in the blood, and they also dilate, in other words, open up certain respiratory passageways. With the digestive system, we do have some specific digestive hormones, but hormones are also used to help control our sphincter muscles to constrict them, in other words, shut them off. They will also depress the activity of the digestive system when it is not needed. And hormones actually coordinate secretions within the digestive system so that we release things at the proper time. In the urinary system, hormones are going to help our reabsorption of both fluid, mostly water, as well as electrolytes in the kidneys. And lastly, in the reproductive system, we have a lot of hormonal influences. For instance, regulating the development and function of our reproductive organs, as well as when we hit puberty, there's a lot of activity that takes place. Uterine contractions are under hormonal control, and so is milk production. Uterine contractions use the hormone oxytocin, and prolactin is the hormone that is used in milk production.